The Dr. Fazil TV show is brought to you by POYA, People of Yuma Health Association. The Dr. Fazil TV show is intended for health educational purposes only and complies with all the HIPAA regulations.
Thanks for coming in. I know it's very hot out there. The hospital is supposed to be your lifesaver and everything. Well, the first thing, and I think we have talked in the past, that to get out alive out of the hospital is to not go to the hospital in the first place, right? There are a few things which we need to know, which I will explain to you in this episode. We can minimize the errors which are done at the hospital level. So my goal is, by the end of the day, by the time you leave this session, you should have a knowledge that can help you to minimize those errors. In one fashion or the other fashion, as a medical professional, we do work at the hospital. I have worked at the hospital in the past. So based on that experience and some other studies done, I can put that on the slide and I can show you how to avoid those errors. And you can see that a lot of germs, all kind of superbugs, they come from the hospital because that's the role of the hospital, to take care of very sick patients. So when these patients are admitted, and then different kind of antibiotics are given, and those can cause resistance to bacteria that's cause superbugs formation. And then they can be transmitted from one person to another person. It's very easy to communicate in the hospital because it's so close. So it's important to watch out for those pitfalls. Background information: I have no financial affiliation with any organization. I'm just doing it at my own time. I love to do what I do. Just don't give away your personal information at the end of the session or during the session. If you do have questions, please do not give away your personal information, because it's being recorded and we air it. And I'm going to give you the statistics on that. Before we move forward, a little bit about myself. I know most people know me, but as we said, we do televise this thing on the network, and a lot of people don't know about myself, so I have to just let them know who the speaker is. I've been in private practice for more than 15 years. I'm an internal medicine specialist. Actually, I have to look at my slide to see who I am, actually. I'm also a kidney specialist. You can do the social media checks. I just checked myself actually the other day. I got an email and I checked it and I said, oh yeah, I got most compassion recognition. I've been getting it for 16, 17, 19, 18, and I think 19 too. They have a system online, some kind of firm, which I'm not affiliated with anyway. They do for all the doctors nationwide, and they pull up their, I think, social media scores based on patient reviews, and then they come up with this award. And also got Patient Choice Award for 2017, 18, and 19. Actually, 19 is missing, but I did get that as well. As same based on you guys' reviews and other patients which are not here. Moving forward, Dr. Fazil TV show, we do talk between patients and doctors, like in the exam rooms, but I wanted to talk kind of like unofficially, not in the exam room. We come up with this platform and we named it Dr. Fazil Show. It's also on the website drfazilshow.com. You can see online. We have approximately around 10,000 views on different social medias. We have checked it so far. We have on the Health Tips TV. We have TVs everywhere now. I mean, in most waiting rooms, at least in our organization, and few other clinics as well. We also on YouTube, magazine. Okay, so let's focus on the how to come alive out of the hospital. One of the most dangerous places for you, your health, is actually the hospital. It's the opposite. Obviously, you're sick, and that's why you're in the hospital. But there are a lot of other patients which are also in the hospital due to being sick, and they bring germs, and then they cause superbug formation, and then can be easily transmitted from one person to another person. So a patient recently, she had a foreign body left by hospital staff. Not very common nowadays, but it used to be common more in the older days. Now they have a system to check when they do surgery. If they use 10 items, they need 10 items back, and it lowers the risk of foreign body placement in the in the wrong places. And but it does happen. It's not like 0%. It's still there. So if you have a sensation of something in there after the surgery, maybe ask your doctor. Um, there was a real incident where a dentist had an endoscopy done, and he felt that there was something left in there. So he went to the gastroenterologist. So one doctor went to another doctor. He said, "I got something in there. You must have left something in there." He said, "Okay, well, I don't think so, but you're a doctor, so I didn't, I did just an endoscopy. I didn't do any surgery, but I'll do an X-ray." He did an X-ray, and there was nothing in there. Now, this doctor was probably have some mental disorder, so he thought if he did an X-ray, there must be something in there. He's trying to find something. So, and it was in California, and you can Google search the incidents. And he go back and forth, and the dentist got so paranoid that one day he took the shotgun and shot the doctor, and he shot the doctor dead, actually, on the side in the clinic. But that was between doctor to doctor, not doctor-patient. But I'm sure it happened at the patient levels too. That was paranoia, but I think it came from the fact that it does happen. It's not a 0%. So that doctor had that thing in his head that something's in there. So it's not true all the time, but sometimes it's true. Wrong drug, wrong dose happen all the time. It's more common error than any other errors. Happens in the clinics, happens in the hospitals. More common in the hospital because they are not aware of your medical background. It's important to bring on your own medications, and so the doctors can see what medication you are on in the past. I saw a patient like last week, I think yesterday, and patient was having lack of coordination. He could not drive at night. He could not go in the straight line, and the reason is that his psychiatrist just changed some medication for depression. His depression was still there, but the side effect of multiple drug interaction he was on that enhances lack of coordination, and then he couldn't drive, and he was having those side effects. And we lowered the medication, and the plan was to eventually stop the medication. But it does not happen all the time. So as a patient, you have to be involved in whatever is going into your system. So you have to let the doctor know, hey, what are you giving to me? Why? And I'm on these medications. So that knowledge is important to provide to the doctor, and doctor have to interact with you guys so that doesn't happen. So wrong drug, wrong dose. I have given example in the past. One of my, back in the days when I was doing my residency, one of the junior members, I think the doctor wrote digoxin, which is a very dangerous, very strong medication. And I think he missed she thought there was a 125 milligram instead of 0.125 milligram. So being a good person, she wanted to get the right dose to the patient before the end of the day. And that much digoxin was not available on one place. So she went to multiple floors, got the extensive amount of digoxin to come up with the big dose, give to the patient. The patient died. And so after that, there was a lot of changes. You have to, how you write your prescriptions. It has changed a little bit now with the electronic medical record system. Those handwritten prescriptions are rare nowadays, but it still does happen, even with the new system. So you can minimize it even in the clinics, inpatient, outpatient. Have your bottles with you. Mostly, I have seen the list of the medication is wrong. The list you have been given to you by yourself, by your pharmacist, or by other doctor is wrong. And the reason is that it's not static, it's not fixed, it's changing over a period of time. So you will go to one doctor, what he's going to do is going to write you a prescription, right? So you go to the next doctor, he's going to write you another prescription. So your list is no more good. You have to remember this thing, that list is a key point of your treatment. So always take your medication bottles with you, unless you're so good at writing all the prescriptions on your list. which is kind of difficult, rare, and confusing. So the best thing is to take the bottles with you when you see your provider. And also the reason is that a same medication can exist in multiple brands. So you wouldn't know, is it a repetition or two different medications. So it's a good idea to take your bottles with you when you see your provider. And I cannot emphasize more than that because this is really important. In one of the study, 200,000 Americans die of what are called preventable medical errors. So, people die for one or the other reason. We're all going to die. I mean, we have mortality on us, but not for medical reasons. We shouldn't be dying for medical errors. We shouldn't be dying for medical errors, not because of things which can be prevented. One of the things which you are not aware is the elevator in the hospital. Everybody use the elevators. Most hospitals have more than one floors, and the buttons are the one which nobody think that they are transmitting infection. So just watch, either use tissue paper to push the buttons or use hand sanitizer right after that whenever you touch the button in the elevator of the hospital. That's where most infections are coming from. If you're not sick, if you're visiting a patient, relatives, your loved ones, when you go in there, you're going to use the elevator. Trust me, it is more dirty than the toilet, actually. They have done the study. So elevator knobs are your Achilles heel in the hospital. And next is your doctor, actually, with the ties. So when you see a doctor with the tie, what's going to happen? He goes, bend over, examine the patient. The tip of the tie will pick up the germs. He goes to the next patient, and he in a day he's transmitting superbugs from one patient to patient to patient. Looks nice that doctor is all dressed up and everything, but in reality, it is danger a vehicle for transmission of germs. So ask your doctor to roll over your tie when he's examining you, or just come in scrubs, All right. So also, any most of the time we expect that university hospitals or teaching hospitals are going to be a better place for you. Wrong. The teaching hospitals are more dangerous than non-teaching hospitals, and the reason is that they train new residents, interns every day, every year, and those are the people who are actually your key contact person. They are least trained person. Obviously, they're going to get trained over a period of time, but they're going to train on you. So, so there's a studies done that teaching hospital has more, especially in July. That's when the new rotation starts every year. July of every year, the new rotation starts for the doctors to get trained. So a new batch comes every year, and they get trained over a period of time. So by December, they have done enough mistakes to not do more mistakes. But if you happen to be in the hospital, in a teaching hospital, in that period of time, you could be collateral damage, actually. Also, Fridays and weekends are bad to be treated at. Most hospitals are least staffed on the weekends and the Fridays. So you will see a doctor who have no knowledge of your previous history, are overburdened by a lot of patients they have to cover during the weekends. So if you have a medical emergency, it is going to get least attention, and maybe by the most junior doctors. So if you have an elective surgery, do not schedule on the weekends or on the Fridays. If it is emergency, yeah, you got to go. But if there's something you can stop, then try to do on Wednesday. How about that? All right, let's go to the next slide. Allergies happen all the time. When we ask the patient, are you allergic to any medication? They say, not I'm aware of, and then after the medication start to go in, they will say, oh yes, I was allergic to this medication. By that time, you're already having allergic reaction. Now, if you did have allergic reaction to anything and you did not know, you got to write it down so you can have it available to next time for the next doctor. So please ask the doctor what allergic reaction you had, what was the medication, write it down, save it. Unlike medications, your allergies do not change that much, so your list is going to be okay for that nature. So if you do have allergic reaction, it happened in our clinic all the time. If we gave a medication to a person, the patient did not have allergies in the past. Now they have a reaction. Most of the time, patient do not ask the name of the medication. They say, "Oh, okay, I'm allergic. I have allergic reaction." We might document that in our system, but it would not be transmitted to a next system if they go to see another doctor, because the patient have to know that. They have to tell the doctor, "Hey, I'm allergic to this medication." So please ask, if you do get allergic reaction at any time in your life, write it down, transmit to the next person. It will minimize damage to your health in the future. Okay, so you can mark down the place you're going to have surgery. It is to prevent wrong side surgery. So you can actually kind of like let the doctor know a day before, okay, we're going to have this surgery right here. I'm going to mark it. It's one step more to prevent wrong side surgery. And do not eat before your surgery. During the anesthesia, people tend to vomit, and that can go to your lungs and can be very dangerous and can cause pneumonia and a lot of other chemical reactions. So if you're going to have anesthesia, and you just need to know that you cannot eat a few hours, like at least 8 hours before the surgery. Now if your loved one come in and want to feed you in good faith, say no. Your nurse come in and she forget that you're going to have surgery that day, please say no. That's kind of like a standard operating procedure. Also tell your anesthesiologist what kind of medication you are on and if you have allergic reaction in the past, because you wouldn't be able to tell him under anesthesia. Tell him before that, please. All right. So it's also a good idea to have your somebody with you, family members. They can follow you through during the hospitalization, so they can be your patient as a patient advocate. They can talk to the nurses and doctor on your behalf, because you might be very sick and you might not be able to bring up the conversation with the providers and decision making. So somebody who's not sick should be with you most of the time, if not all the time. That will minimize errors at the hospital. And please write down your name. Trust me on that. It happens all the time. Doctor goes in there. There are two beds in the exam room, in the hospital room, or three sometime, and they thought it was not patient A or B or C. The patient is like unresponsive or is so sick that cannot communicate with the doctor, and doctor went to this patient B instead of A and treated opposite treatment, and could be disastrous. So have somebody write down your name on the hospital bed, and hopefully they wouldn't switch the beds and then the whole thing is messed up. But that would be a good idea to, the moment you get admitted, put your name on the bed so they know who you are, not 12C or 12B, your name on it. That will help. So talk to your nurse before she throws a medication into your mouth, what she's giving to you, because they can make a mistake too. Same thing. Instead of A, B, and C, they can go to wrong patient and wrong medication. Just like doctors, they do have training rotations every year, and the junior nurses can make mistakes. So don't be a victim. Just talk, communicate what I'm getting, and most of the time you would be able to find out this is not you're supposed to get. So that could be prevented. And then the last thing is, we are at the end of our discussion right now. Choose your hospital carefully if you have a choice. If you do not have a choice, then obviously it is what it is. But if you're in a city where a lot of hospitals, do your homework before you go in and have a kind of mindset. If I'm going to get my surgery done or any procedure done, or if I need to be admitted, I need to go to this hospital or not that hospital. So you can do your research beforehand, not at the time of admission. So you could be directed to the right hospital. So that was the end of the whole conversation and episode. Thank you so much. And now, if you have any questions, you always ask questions.
mentioned hand sanitizers earlier, but I have read that some of them aren't effective at all.
So you have to choose the right hand sanitizer. Generally, they have alcohol in there, and that should be enough to kill the germs, most of the germs. But it's still better than having nothing at all. So don't get something made in China. I mean, obviously, get a good hand sanitizer with some 70% alcohol in there, or germicide, and not for just for for perfume or anything like that, but it should have germicide inside. So look into the ingredients of the, and I think Christian have a point.
I think you may be referring to the bug C. diff coming from your stool, and they recommend that you use soap and water instead of a hand sanitizer.
Silver gel will kill germs up to 6 hours.
Well, that's a good point, because it's the ointment is going to stick with your hands. Alcohol will vaporize. Yeah, so that's a good point.
The VA sent me over to the emergency room here in the hospital
Okay.
Monday. So I'm laying there. They got me stripped down, laying there on a gurney. And I remember what you said last week about this. How do you get out of a hospital alive? Scared the hell out of me.
You're right, and I can tell you, back in the days, and I'm not going to name the hospital because, but you can imagine. So, anyway, I was called that there's a patient who has kidney failure, and they did a blood gas analysis, and they called me on the phone, and I said, okay, give me the numbers. And they gave me the numbers. Based on that numbers, like the tests they were running on the patient, I told the doctor, I said, listen, this patient is probably not breathing at all. I think you go and need to check the patient. I'm coming on my way, but I think his patient have a lot of acid in the blood, put it that way. The acid in the blood could come from the kidney failure or from not breathing at all, because we breathe out the carbon dioxide, and then we excrete the acid out of the urine as well. So you can have more acid in the blood, either you're not breathing or you're not making enough urine. So based on that numbers, my analysis was that patient was not breathing at all, or could be in imminent danger of not breathing at all. So as a emergency room specialist, I said, listen, I think you did not see the patient. You need to go and check his breathing rate. I said, no, you probably don't want to come. I said, no, I'm on my way, I'm driving, but I just want to make sure that I think this patient is probably breathing at four breaths a minute, not 12. And that was right. When patient was, by the time I went to the emergency room, patient was already intubated on the breathing machine, and my analysis was accurate. And I think after my conversation, the ER specialist went to the patient, and yes, patient was not breathing at all, so he intubated the patient. So few good conversation saved the patient, but that patient could have been dead, and it happened. I mean, I don't know how many times it does happen, and we don't even know about that thing. But there was one old example where patient was dying in the intensive care unit from respiratory failure in a certain period of time. So they didn't know what was going on, and eventually they put cameras in the rooms, and they found that a janitor would come in. He want to clean up the rooms. He will pull up the plugs of the breathing machine, clean up the room real good, put it back in after 15 minutes. By the time patient is dead. So he didn't know what he was doing. He was like, hey, I'm a good person. I'm just cleaning it, make sure that all the things are cleaned up. And the machine is working afterwards when you plug it in. Seems like patient is still okay. But patient is, have no breathing and is dead. And obviously now the machines are automated, so they have a backup system. If there's no power, they will alarm or have a batteries inside. But it was before those changes were made. So yes, you never know where those new errors are going to come from. You never know. There's always a possibility. So don't go in the first place. But if you end up there's a lot of things you have to do at your level too to keep the errors at the lower rate. Good. Anything else?
Can you just give us a short list of superbugs in the hospital that you might find concerning?
Well, there's a MRSA, we call it MRSA, and there's no mercy. They remember that way. When you get MRSA, there's no mercy. MRSA is a special kind of bacteria which is, is not susceptible to regular antibiotics. So mostly you get it from the hospital. Very difficult to treat. There's a few medications which are used to treat this one. One is vancomycin. Second is Zyvox. Very expensive, and you can actually keep that the MRSA in your nose. Most people carry in their nostrils and the nose, and if you pick your nose and you kind of like, you can scratch your skin, you can have that infection on your skin too. So the second is VRE, vancomycin resistant enterococcus, which is a different kind of bug. Then third one is the C. diff. C. diff is not a bacteria, but it's a kind of like a bug which causes diarrhea. So if you went to the hospital and came home and have a lot of diarrhea, you probably got the C. diff infection. So anytime I see a patient with diarrhea, I ask them if they were in the hospital recently or if they were seeing somebody in the hospital or in nursing homes. And if there's a suspicion, we can order a stool test, and then the treatment is totally different. So yes, that was a good question. Great. Well, if the next episode is going to be, we are pretty much wrapped up the weight loss session over a year and a half period of time last time. So since things have changed a little bit and there is a new audience, and we're going to start it all over again from episode 1 from the next month. It's going to be on June 28th, the last Friday of June. Same time, same place. So I hope you would be there, and we'll have talk and questions, and now we're going to have some food. Thank you so much for coming in.